a primary series of the COVID-19 vaccines has shown to maintain high vaccine effectiveness and to provide powerful and persistent protection following the second dose, the province is planning to expand eligibility for a booster dose to all Ontarians aged 12 and over in the coming months. Emerging evidence suggests vaccine effectiveness against asymptomatic infection in mild illness may decrease over time, and a booster dose could help to restore and maintain protection against infection.
Health officials have been talking about it for months, and now Ontario is all set to roll out booster shots. The province's top doc announcing nearly 3 million people can start booking their third vaccine dose this Saturday. You are eligible if you're a frontline healthcare worker, if you receive 2 doses of the AZ vaccine, if you're 70 or older, or if you're an Indigenous person in this province.
You must have had your second dose at least 6 months ago, though. So what do we need to know about booster shots? For a closer look, we welcome to CP24 tonight Dr. Zain Chagla, infectious diseases specialist at St. Joe's in Hamilton, Dr. Susy Hota, medical director of infection prevention and control at the University Health Network, and Raywat Deonandan, an epidemiologist and professor at the University of Ottawa. Good evening to you all. Dr. Chagla, this might sound like a stupid question, but we were told at the onset of this, 2 doses and you're done. So why do we need these third doses, and is it pivotal to get them?
Yeah, so, I think we had a lot of hope, obviously, when these vaccines were coming out, but they came out, the trials came out, and we started administering them. And really, a lot of this is learning. We also had challenges with the variant and the Delta variant where there is a bit more immune escape. And then we had time to see what happened with this. The vaccines worked immensely, and they are working really effectively even as we speak, keeping our hospitals safe, keeping our community safe. But recognizing there are some communities of people where breakthrough infections are occurring, albeit much less as if they were not vaccinated, where those breakthrough infections are leading to hospitalizations and severe outcomes. And optimizing immunity in those populations, particularly those over the age of 70, those from Indigenous communities, may offer not only the benefit of shielding those populations a bit more where a breakthrough infection may be serious, but also, particularly in Indigenous communities, preserving healthcare systems in fairly remote places. So, again, this is smart strategy. This is targeting towards populations where 2 doses may not be enough, and optimizing immunity is important. But again, recognizing that those 2 doses are still functioning very well for our population, and they're essentially changing the face of this disease to a manageable threat.
Dr. Hota, there are people out there who are thinking, a third dose, a booster shot? Does that mean the first 2 weren't effective? Talk to that person tonight. And what do you think we need to know about booster shots?
Well, I think as Dr. Chagla had said, the 2 doses that you've received are protecting you. We still see very high levels of protection after 2 doses, out to 8 months with some Ontario data in the general population. But where we start to see things waning a little bit, where we're seeing, some of the severe impacts like risk of hospitalizations and even death, unfortunately, is in older people. And this is not a new thing. We know that the immune system functions differently as you age, and that vaccinations may have less effect or may wane a little bit more quickly in older people because of the way that the immune system functions. So, I don't think this should be a deterrent to getting vaccinated at all if you haven't yet gotten vaccinated. We understand that, different vaccines work differently, and sometimes the durability might not be as long, and we might need to have booster doses periodically. But, we're in a pandemic. This is an important intervention for us to get through this pandemic and keep everyone as safe as possible and keep the healthcare system functioning so that we can still care for people. And that's really the big rationale.
Raywat, I think a lot of people look at the case counts day to day. Ontario is doing quite well. We're somewhere in the 300 range. So a lot of people might be putting it off, for example. Oh, I'll get that third dose once things start to ramp up and become the COVID situation in the province becomes worse again. What kind of science do you offer these people to say, no, maybe you should consider getting it when you're eligible in the next few weeks or months?
Right. So if you're one of those people who is immunocompromised or older or susceptible to the bad outcomes of COVID as we all know it, you should really consider getting that third dose when it becomes eligible, because you are protected then. Look, just because the case numbers are down doesn't mean we're out of the crisis. There is still a probability, albeit lower every day, that you will be exposed to this disease. And if you're exposed to it and don't have optimum immunity, you've got a real chance of getting sick and possibly being hospitalized and possibly even dying, especially if, as Dr. Hota mentioned, you are an older person. So let us abrogate that risk by accepting as much mitigation individually as we can. That means accepting a third dose if, in fact, you are eligible for one. Now, there will come a time when we have to talk about whether these non-immunocompromised younger people are also eligible and warrant a third dose. We'll have that conversation later on. But for those who are eligible, I think it's a really good idea to get that dose.
Okay, Dr. Chagla, we heard from the province's top doctor today saying COVID will likely become an annual winter virus. I know a lot of people are thinking, what is the end game here? Is this kind of like the flu shot, a new strain every year and a new shot every year? What do you say?
Yeah, I mean, it's too early to tell. We do have vaccine series out there that are 3 doses, right? Our hepatitis B vaccine, we give a dose a month or 2 later, and then a dose at 6 months to get that final immunity. And so this may be a 3-dose vaccine at the end of the day. The virus evolves, the virus has changed, and that's really what's led to our need to catch up with these vaccines. And so, as long as we're vaccinating aggressively internally, as long as we're vaccinating aggressively externally, the viral evolution will settle down. We may not see a need for annual boosters for, everyone's lifetime. We may need a few doses over the next few years. But again, time will tell. Not to say that this is an ineffective intervention, but it really is our pathway to living with this virus, is giving the population optimal immunity. And again, we'll learn more over the coming weeks, months, and years in terms of when that immunity wanes, or if that immunity wanes. And the ideal series is, 3 doses.
We've heard that 6 months is kind of the optimal time range. 6 months after you've got your second dose, be prepared to at least consider getting your third dose. Dr. Hota, we heard from Dr. Tam, the country's top doctor, earlier this week that we're not at that point yet about talking about booster shots for the general population. So what do you say to these younger individuals who make up the brunt of our workforce as well, who might be watching, who are saying, I'm not so sure I'm in it for number 3, and then potentially more down the line?
Yeah, I mean, I agree with Dr. Tam that we don't have the complete data yet as to whether, younger individuals and the general population really need to have boosters, and if so, exactly when. When do we hit that sort of threshold where it would be critical to boost up the immune response so that we get a better protection individually, but also on a bigger scale population-wise? Now, that said, there are some kind of groups. For example, healthcare workers have been singled out as, being eligible at this point in time, 6 months after their second dose for a booster shot. And some of that is kind of weighing some of the other priorities. For example, keeping the healthcare system running. We know that this is a critical service right now as we continue to deal with the pandemic and try and catch up with other healthcare. So we've seen that, and regardless of age, that's being offered to healthcare workers. So, I think we will learn over time. Some of the data that we do have from the real world setting and what's happened as we've rolled out vaccines across the world is suggesting there is some waning of immunity in younger people, but it's really a matter of when do we hit that threshold of it actually being really relevant.
Raywat, I'm curious how you see this rollout happening. I remember back when the vaccination campaign began, there was mass hysteria, people going to these mass vaccination sites. Doctors' offices and pharmacists were having their phones ringing off the hook with the demand being bigger than supply. Do you envision it being like that once again, considering it won't be long till we start vaccinating children potentially in this country as well?
I don't see it as being that hectic. Already my physician spouse is getting calls from her patients asking for their booster shots, but they're not aggressive calls. They're not untoward. There is a desire for this shot, but it's not overly busy yet. I think what's going to happen is the deployment process will be a lot more streamlined now than it was a year ago. The drug companies will be involved. Pop-up clinics will be involved. The delivery will be much easier. The supply will be much more fluid. I think it'll be a much more cleaner process. Now, what does come to mind, though, is what does this mean for the long-term status of the epidemic? And I think we have to keep in mind that there's a pandemic rolling around the world, and we're talking here about third doses for us. We should be talking more about first and second doses for the rest of the world.
Dr. Susy Hota, Dr. Zain Chagla, Raywat Deonandan, thank you all so much for your expertise tonight. We really appreciate it.
Thank you.
All the best.
Thank you.